Good afternoon, everyone. Thank you for joining us. My name is Stephanie Verna. I'm the Program and Research Manager here at the Injury Prevention Research Center at Emory, also known as IPRCE. And we have our summer internship opportunities webinar for you. Just a couple of things. If you have any questions, go ahead and put them in the chat and we will answer them. But we hope that we answer all the questions that you can throughout. I'd like to hand over the start of our presentation to the director of IPRCE. And so, Jonathan, take it away.
Hey, good afternoon, everyone. I'm Jonathan Roop. I'm a professor in the Department of Emergency Medicine at Emory and the director of the Injury Prevention Research Center at Emory. Before we talk about some of our summer student opportunities, of which there are quite a few, and we're very excited to talk to you about those and hopefully encourage you to apply, I'd like to tell you a little bit about the Injury Center. Next slide, please. Or at least I guess I'd like to tell you a little bit about our agenda today first. I'll talk a little bit about the Injury Center. We're going to talk about multiple different fellowship programs, our Summer Injury Research Fellowship, our Scott Lilienfeld Injury Prevention Scholarship, our CDC or our Injury Center funded CDC internships, and then a set of other summer internship opportunities that our center funds, as well as our center's partners fund. Hopefully within this, you'll find something that interests you that you would like to apply for. So IPRCE, which again is the Injury Prevention Research Center at Emory, is a collaboration of faculty and community partners that exists to reduce the top causes of injury and injury death in Georgia and the Southeast through research, education, and outreach. Our summer student programs are really part of the educational component of this. The goal of these is to place students with partners and help them further their careers in injury prevention. IPRCE does a whole lot of other things in addition to education. We support outreach to partners, we support meetings and events, we support research projects. Our focal areas are injury, including falls, transportation injury, traumatic brain injury, overdose prevention, including medication safety, and violence prevention. So if you're interested in one of those areas, IPRCE is the organization to connect with. Okay, next slide. Okay, so I'm going to pass it off to Dr. Hannah Cooper to talk about our Summer Injury Research Fellowship, or SIRF.
Yes, thank you so much, Jonathan. I am Hannah Cooper, and I get to work with Stephanie and Jonathan and several other people on this call on the IPRCE Center. Within that world, I get to lead up the research core. And then I'm also on faculty at Emory's Public Health School. I get to, as a part of this work, I get to head up the Spark program on substance use research. And one of the things that we do is we have a training arm that really aligns very closely with IPRCE. And so we've collaborated with IPRCE to develop the Summer Injury Research Fellowship Initiative. I'll tell you about those opportunities, and you'll hear actually from GDPH in a moment about kind of some more of those specifics. We can go to the next slide. Thank you. So SIRF is designed, that's kind of a stream of summer internship opportunities that's designed to strengthen injury prevention and response in Georgia, and also to train the next generation in injury prevention research and practice. SIRF has got 4 different components that you should know about, or 4 different features that you should know about. It's a 10-week paid fellowship that runs over the summer, typically from June to August. We know that many of you are going to have summer plans, and so we can always work around those within reason, right? So if you have a week holiday coming up, we can work with you on that. SURF consists of full-time placements over that summer with the agency mentor. And then you have an Emory-based faculty mentor, and that's typically myself. I want to be clear that all of the work that you're doing will be done with your GDPH, with your agency mentor kind of at GDPH. It might be virtual, but you're really going to be contributing to GDPH, so you won't be based at Emory. And I think that's a real plus, I think, of this opportunity. At the end of the SURF fellowship, you should be coming out with some kind of written deliverable. It could be a report, could be some kind of evaluation, might be part of a manuscript. And then you will also do a presentation, and that helps to kind of have this fit the practicum requirements. Throughout the 10-week fellowship, I'll be meeting every other week with the folks doing SURF. And we'll be talking about just, troubleshooting, how are things going? And then we also talk about how to help make sure that this particular experience is a launching pad for whatever you might want to do next. So we'll pay close attention to that. Next slide. To be eligible to take part in SURF, you have to be a full-time doctorate or master's student with a strong academic record. You also have to have at least one more semester of coursework left. So typically, people have at least the fall semester in 2025 at the time that they're applying. They might have a full year, of course. You have to be able to demonstrate several competencies. That's just something that we keep in mind when we are evaluating the applications, and it helps make sure that this is a successful match. So we're looking for students who have a good understanding of the epidemiology of injury, whether unintentional or intentional. Knowledge of the impact of injuries on health and society, right? That could be mortality rates, morbidity, disability, years of life lost. And then also the ability to identify and apply public health strategies and principles to the prevention and control of injury. So those are the things that we look for when we're reviewing applications for SURF. And I think now I turn it over to our GDPH partner, is that right?
Yes, and I'm going to actually do this slide. So thank you so much, Hannah, for talking a little bit more about, the eligibility of our SURF partners. And so we have a couple of our Georgia Department of Public Health friends on the line. And so thank you for coming to hang out. And so mainly our SURF partner is, like we just mentioned, the Georgia Department of Public Health. That is mainly who you'll be working with. And so the mission and the vision that they really try to uphold and teach you guys is using state and local coalitions through data, training, leadership, and leveraging all the different types of resources that we have within the different prevention programs that are located within the department. And so they basically want to focus on the burdens that are fully minimizing by empowering you guys to use all of this different training and achieving this culture of safety. And so with that being said, there are two positions that we are offering, or that I should say, Georgia Department of Public Health is offering this summer. One is going to be in the injury prevention program, specifically the Division of Health Protection and Safety. And so that is going to be in the Comprehensive Suicide Prevention Grant Program. And then our next position, or their next position, is going to be in the Opioid and Substance Misuse Response Program. And so students are going to work closely with the individuals within that program on overdose surveillance and prevention and the response. So those are the two positions in the two different areas that the Georgia Department of Public Health is offering in our SURF partner program. And so to break it down a little bit, I'm going to move it on over to somebody who represents the Comprehensive Suicide Prevention Program, and that is Ainsley. And so Ainsley,
Thank you. Thank you so much, Stephanie. My name
nice.
is Ainsley Rebstock Gleason, and I am the Communications and Implementation Specialist for the Comprehensive Suicide Prevention Program. Just to kind of give you a little overview, we received 5-year grant funding from the CDC to expand their Comprehensive Suicide Prevention Program into Georgia. And we are focusing on 2 disproportionately affected populations here in Georgia. And our grant cycle is from 2022 to 2027. So just to give you an idea kind of what our goals are with this funding opportunity, we are going to convene and connect multi-sectoral partners. We're using surveillance data to kind of understand the contributors to suicide and suicidal behaviors, and to also track the morbidity and mortality trends. And then we're going to use that information to assess gaps in programming and also to implement suicide prevention strategies and approaches using the CDC's provided kind of 3-tier system in their technical package. And then we also will communicate our progress, the trends that we find, any lessons learned, and our successes to our partners. So the disproportionately affected populations that we are working with for this cycle of the grant. The first one is, our DAP one is military and emergency services personnel residing in Georgia, which is identified as anyone who has served with any branch of the military, including the reserves, and then also those who are in first responder positions. And then our DAP 2 is going to be youth and families ages 10 to 44 living in the Clayton County area. So that is kind of the long and short of CSP. It's a great opportunity. We're going to have some roles and responsibilities for planning, implementation, and evaluation of the prevention projects. We will give the opportunity to prepare and deliver presentations. You will be conducting literature reviews and summarizing those findings, and probably have the opportunity to do a report on those findings, as well as assisting with grant-related surveys, contributing to the program evaluation efforts, and working closely with us on the sustainability portion of the CSP program, since we are going into, or we're in year 3, and then we've got year 4 and 5, and those are really going to be heavy on working on sustainability. So that is going to be like a definite highlight. And then we just got our injury prevention website up, so you will be helping with maintaining that, checking that all the links are working, doing some updates as needed, and as well as researching and analyzing behavioral health assessment surveys that are used in Georgia, and then reporting on that. So that is the opportunity that we have. And please let me know if you have any questions in the chat. I can put my email and my the rest of our team's email in there if you want to reach out. And then I will turn it over to our next speaker, who I think is...
It is Donovan. Yes.
Donovan. Yes.
Yes.
I was like, I know his name.
Thank you, Ainsley, for explaining all about that opportunity. I'm gonna move on over to Donovan so he can talk a little bit more about the opioid and substance misuse program and the opportunities that they have. So thank you so much, Donovan. Take it away.
Absolutely. I also have one of my colleagues on the line who will give a little bit more information about that first project listed here, PDMP Data Linkage Project. Rasaki, are you on the call, sir? I know he's on the call.
Yes, I'm here.
Okay, I was gonna say. All right, Rasaki, can you give them a little bit of information about Project 1, and then I'll take it for 2, 3, and 4.
Yeah. This project, I mean, so first I would like to introduce myself. So my name is Rasaki Aromalate. I'm the PDNP epidemiologist, which is Prescription Drug Monitoring Program epidemiologist with DPH. So we basically do monitor rates of prescription and dispensing of opioid, benzodiazepines, and stimulants in the state of Georgia and other controlled substances. So this project is basically going to be about we want to actually check the risky behaviors among people that are infected with hepatitis A, B, and C. This is kind of a kind of linkage, data linkage between our prescription drug monitoring program data set and that of the hepatitis infection. And so we want to understand, these infected people, if we can actually see the rate of prescription and the use of opioid amongst them. So the student or the intern that is going to be working with us, we actually have the opportunity to be able to do a lot of SAS coding. They are going to do a lot of literature review to understand the rate of drug use among people with hepatitis A, B, and C. The data is going to span between 2020 to 2022. So we are going to do the linkage based on their name, their first name, their last name, date of birth, their social security number, if possible, their county and the zip code. So this will help us to be able to, being able to identify people infected. They will have the opportunity to, do a critical literature review and help develop a, research question, being able to, guide them on how to, do a lot of SAS coding and doing the analysis that will help them be able to give us a good result. We help them and guide them with interpretation of the result. And also they will also participate in some of the things we do, like data requests that we do, which we get a lot most of the time. So they will also be guided on how to identify the appropriate variables in the field of the data set that we want to use for the purpose of the data linkage. They will also have the opportunity to write abstracts, do presentation of their findings, and regular monitoring of what they are doing. So that is a brief overview of the project. I will turn it over to Donovan to complete the rest.
Yeah.
Thank you.
Thank you so much, Rasaki, for that information. So if anybody is interested, novice level epi, or you're further along in your studies, I definitely think that would be a great opportunity for you to get a lot of experience. Rasaki didn't include the fact that we have a lot of national partners who are very interested in the outcome of this data. The PDNP is typically utilized as a more clinical, in some states, a regulatory tool. But with us being EPI, we wanted to see how we could utilize it beyond its standard purposes. So we're able to do that, and we're getting some good interest and some success. So there's definitely an opportunity there as well. All right, so our second project is our Syringe Service Program Enhancement Initiative. Department of Public Health has done a really great job with getting our syringe services programs forward-facing. We've been able to put on a website. We have a certification process so that we're able to get more of our harm reduction partners certified to begin needle exchanges. So just for a little background information, I'm sorry, I don't want to assume that you all know what needle exchanges are. Needle exchanges are an opportunity for individuals who participate in injection drug use to go ahead and exchange their dirty syringes that have been used, or maybe they've been broken or anything like that. They can switch out those old syringes for clean sanitary syringes. So that is a really big program. And even though that is the the work that is done, they also connect those individuals with other HIV screening, tuberculosis screening, hepatitis screenings, wound care. So it's a lot that goes on here. So this will be a great opportunity for anybody who is looking for prevention experience, getting an understanding of community-based relationships and the different challenges that exist there. All right, and then making sure, okay, I sent it over in the right order. All right, so our third project is our OD MAP project. Let me see, I have it written here because I forget what OD MAP stands for like all the time. Overdose Detection Mapping Application Program. It is essentially a system that law enforcement utilizes to understand where outbreaks are occurring, where opioid overdose outbreaks are occurring. Specifically, we have public health analysts that are situated across our 18 health departments, and they are charged with getting law enforcement on board. So a lot of this here will involve looking at the registrants that we currently have and those that we need to capture, and then communicating that information to our district level employees. So we do anticipate this to be a pretty short project. We've kind of put together some things to make this as turnkey as possible. I do think this is definitely an epidemiological initiative here, but it is one for more of, if you're earlier in your studies, I definitely think this will be easier to grasp. Certainly we could do SAS or R if you would like, but you can also do this project with Excel as well. And then our last project, and let me also say, these are 4 separate projects, not for one intern to complete all of them. That is not our expectation. So these are 4 different opportunities that you're viewing. And so the 4th one is our overdose awareness campaign. We've taken a look and realized that we have a lot of observational dates over the calendar year that we would like to do a lot more work with. We're really trying to figure out exactly what that will look like, but we know that we're going to need some support with gathering information and really putting together an awareness campaign. There are several different dates that we've identified. January, for example, is Substance Use Disorder Treatment Month. So an intern in that position would more than likely help us reach out to partners, gather information to put together for a campaign. We'd have to run everything through our communications department, of course, but really getting that information out there to get more supporters before that day of observation comes. And so again, I would look at that one to be a more prevention-oriented goal, not as data-intensive as our other things. So that is all that I have. Thank you all.
Thank you so much, Donovan, for bringing those project descriptions to us. I think it's important that students kind of know like what we're looking for and what they might be doing to kind of choose like if that is something that's for them or not. So thank you. I do appreciate that. Back to, I believe, Jonathan or Hannah with our surf timeline.
I'll quick talk through the timeline since I'm up for the next couple of slides.
Sure.
Okay, so surf applications are due February 5th, 2025. Following that, there'll be interviews that will be set up with both Emory faculty and the applicable people at the Department of Public Health beginning at the end of March. We will check references for folks who apply and notify at the beginning of April with fellowships starting in June. The date will depend some on the availability of the mentor, with a target end date in August before the semester begins. Stephanie, anything else you want to add?
Sometimes it is a little bit of a sliding scale, so we try to stick to this timeline, but it may be here and there, like off by a week or two, depending on the process. But this is what we try to stick to, and our deadline will be firm though on February 5th.
Yep. Yes, and one thing I will add, and I'll probably say this again, is that IPRCE's website has all of this information on it. So if you're looking for something that you don't see in this presentation or a link, check the IPRCE website. Next slide. Okay, so this is a little different than the other opportunities we're discussing today. The Scott Lilienfeld Injury Prevention Scholarship is something that our center gives out each year in memory of Dr. Scott Lilienfeld, who was part of the IPRCE Injury Certificate Steering Committee and was really instrumental in us establishing an injury prevention certificate at Emory. So this is actually a grant to a student to work on an injury-related project of their interest. The only requirements that we place on this are that the project has to be applicable to an injury problem in Georgia, and we construe that very broadly. We'd like for that problem to be within one of the focus areas of IPRCE. So violence, transportation injury, falls, traumatic injury, brain injury, and drug safety, including overdose prevention. Next slide. Okay, so to apply for the scholarship, you need to submit a resume or a CV, a brief description of what you propose to do with the funds, a letter of support, and you need to complete an application form. The scholarship is a $3,000 stipend distributed at the start of the summer. At the end, you'll get a certificate of completion of the scholarship, and you'll be asked to present the results of your work at an IPRCE quarterly meeting with the Department of Public Health. The idea behind this is that we want our partners to hear about all of the great work that you did. You'll also receive recognition on the IPRCE website, and the IPRCE staff will work with you to develop a publication brief that will exist also on the IPRCE website that you can point to when you go out and apply for jobs. The deadline for this is February 21st. And thank you to Paige for posting the IPRCE website in the chat, because that is where you'll find the link to the application for this. Next slide. So as I mentioned at the beginning of this, the Injury Center supports 1 to 2 summer scholarship opportunities to work at CDC. These are organized and managed by the Injury Center at CDC. Each of the injury control research centers that CDC funds, there are 11 of those, has the opportunity to send 1 student and sometimes more for an internship at CDC. These internships are paid by the Injury Center. They are 8 to 12 weeks in duration. In this case, this is limited to Emory students only by requirements of CDC. That is not us doing that. Again, June through August, these are typically 20 hours a week to full time. You're paid with a $5,000 stipend. So it's really up to you to work the number of hours needed to get the work done. In the past, these have been incredible experiences for the students who have completed them. They have worked on projects such as Whiskers, CDC's injury-based web query tools, and other things relevant to the mission of the Injury Center. Again, the application is available on the IPRCE website. Also, on the IPRCE website and contained within the application are more details about the different opportunities at CDC that are available. They span pretty much every area of injury and violence prevention. And this slide just lists some of the titles of the internships. I'm really not going to read all of them. I think you all can read them as well. But I think what's important is look at the diversity of the topics here and the opportunity to work with a CDC scientist on a project that aligns with your interest. So the way this works is you all apply to us. We pick the top candidate. Each candidate ranks the opportunities in terms of preference, and then we forward our selected candidate to CDC, who then finalizes their placement. So typically you'll get your top 1 or 2 opportunities. Sometimes it goes down to the 3rd, but as you can see, these are all pretty excellent opportunities. There is the potential, right, this year they have 11 centers and 14 opportunities. So there's the possibility for us to send 2 students, which we may do if there are a whole lot of highly qualified and interested students who apply. The deadline for this, though, is very short. This is a result of when we hear from CDC. We need to have applications completed by January 29th at 5 p.m. It's a web-based application that needs to be completed. And we will make a decision very shortly thereafter that. I think we have a meeting scheduled for the next day to review and discuss. Next slide. So I also have 6 summer intern positions that I hire each year to work on a roadside observational survey to characterize rates of seatbelt use and distracted driving in Georgia. Observers travel to predetermined locations around the state of Georgia and characterize the number of drivers and right front seat passengers who are wearing their seatbelts and the number of drivers who are distracted. We use this information to provide estimates that drive injury prevention dollars going to different motor vehicle injury prevention projects in the state of Georgia. This is also mandated by the federal government. The state do this every year. It's a really great experience and really strong applied both observational research as well as field epidemiology. Students in the past have done applied practicum experiences for this, and we welcome that and encourage it. One thing I will note is that this does include travel and a pretty extensive amount of travel around the state of Georgia for the months that it is active. To apply, send your resume and a brief description of interest to Hannah Glassy at the email address on this slide. This job's also posted on Rollins job sites. We're going to review applications on a rolling basis and start interviewing end of February, early March. Next slide.
So I'm going to I'm going to talk about no problem. So I'm going to talk about some of the other opportunities that we have kind of heard of and are offering to you all that are either right now, like going on right this second, and then are offering in the summer. And so I wanted to highlight in the space of intimate partner and violence / homicide, we have a core faculty member, Dr. Dabney Evans. She's in the Hubert Department of Global Health. She's an associate professor, and she works very closely with us on some research projects. And she's got a lot of different things going on here and there. And so she is looking currently for a real student. And if you are part of Emory University, you know that stands for Rollins Earn and Learn. And so she's looking for a real student that would like to do any of the things that are listed here. So working with the National Violent Death Reporting System, also known as NVDRS, and working with homicide data. And so that is something that you possibly can get a deliverable, such as being part of a publication. And so if you are interested in working within that space and maybe you have questions about it and you would like to connect with her, you can send a cover letter and your CV to the email that I have listed right here. All the information that we're giving is going to be obviously set in an email that everybody has attended today. So if you're not getting it right now, or writing it down or in the chat, no worries. We will get this to you as soon as we have everything uploaded and everything downloaded and all the things. So that is one opportunity, and she is asking for that obviously right now. That is definitely an ASAP situation for the spring semester. And so if you know somebody or if you are interested, that is the information right there. And we'll again send that in an email very shortly after this. Additionally, we, IPRCE, like to hire students for the summer that are interested in injury and violence prevention, have some of those interests. And so We will be having to hire, and so we'll start interviewing and putting out applications on 12/20. That is mostly where we usually gather a lot of our applications from. Or you can email me a little bit closer to March. It's sverna@emory.edu about any of the topics that we really hone in on, and we will need some type of some projects, evaluations, some surveys, all the things. And so that is something that you can also use for your AP, which I know is something that you guys are always looking for. So those are two kind of overarching additional opportunities that we're kind of providing for you today. So the last one that's a little bit more, again, something that's kind of like right now, they are interviewing and they are taking applications. One of our partners is CHOA, or Children's Healthcare of Atlanta, and they have a couple of programs attached to them, Safe Kids. They also have Strong for Life. And so they're looking for 3 child advocacy interns that are going to work a little bit more within injury and violence, but more on the adolescent, like children's side of things. And so child passenger safety, firearm safe storage, injury and illness and prevention. And they have 3 positions, like I said, and they're taking applications right now, and they will be interviewing starting in February. So again, that is actually on the website. If you want to Google it right now, CHOA, look child advocacy intern, that's all uploaded to the children's website that you can apply right now. But again, all of these links and this actual presentation will be sent to you a little bit later on. And so that is all that we have as far as the different types of opportunities. It is a lot and it has a lot of different information. If I can have some of my helpers go ahead and put Rhiannon, yes, girl, we have some help in there. So our links for all of the different surveys. The one thing that I will say, if a survey is not working correctly, because there are some issues using some type of browser extensions. If Safari isn't working, use Chrome. If Chrome isn't working, use any other one that you can find, because that does happen, I know, with a lot of Qualtrics applications. So try to maybe, if instead of using it on your phone, use it on your desktop if you have that opportunity. Those are all the applications for our CDC summer internship application. Again, that is going to be due in about a week and a half. So make sure that you gather all of the things that you need, and it's 5 p.m. on next Wednesday, the 29th. Additionally, we have our SURF intern application, and that is going to be due February 5th at 5 p.m. for the 2 opportunities that we talked about. And then lastly, we have an application for our Lilienfeld scholarship, and that is going to be due on February 21st. So I wanted to open this up to what questions you all are kind of marinating in your head about. If you haven't already put it in the chat, you can go ahead and unmute, or you can go ahead and put it in the chat. We're welcoming questions about any specific programs that you're not quite sure about. Additionally, if you have questions we have our people on the line from the Georgia Department of Public Health. If you have specific questions about that, you're more than welcome to ask that, or any of the other opportunities that we are offering today. We would love to answer that right now for you, that we have you right here. So if you want to go ahead and unmute, now's the time, or you can go ahead and put it in the chat. And thank you, Jonathan, for putting the Summer Student Opportunities website. That is the direct link on our website to all of our applications. Scroll all the way down to the bottom, and you'll find the SURF and the CDC one right away. Arabella has a great question. Do you recommend that we become familiar with any data analysis software programs? Now, that's always a great recommendation, regardless of whatever program you're in. I wouldn't really say there's anything specific. As Rollins people, we know They love some SAS 9.4. We also know that the CDC works very closely with SAS, so that's a good marrying situation. But I wouldn't necessarily say that you absolutely need to be an expert to apply for any of these. This is kind of the learning portion of your education. And so if it comes about that it's something that's necessary, I would say that our Georgia Department of Public Health, the opioid misuse program, that first project that we talked about will be utilizing SAS. And so they will probably be more than welcome to assist you. But like a really nice, we have a nice foundation, a little intro, if you will, if you are in all of the programs in your MPH at Emory. But I wouldn't necessarily that keeps you from doing or applying or what have you. But our most popular ones per usual are our R and our SAS. But I wouldn't say that anything you need to go out there and start doing a boot camp so that you can do this. Mike Thomas asks, for the IPRCE positions, are you only accepting one student per project? If you can go ahead and expand upon that, Mike, do you mean for the summer, the IPRCE positions?
Yes, yes, I meant the summer. I apologize.
Oh, so we have many projects that are going on specifically in the summer for IPRCE, like on that position.
Yeah.
So we might have more than one. If you're talking about surf, there's only one in.
Oh, that's what I meant. I apologize. That's what I meant.
Oh,
Sorry.
okay. Yeah. So one position for comprehensive suicide and one for the opioid drug misuse and program. Is that what you were looking for?
Okay. That's what I meant. I apologize for that.
Yeah, no worries. I know it's a lot. It's a lot. We got confusing things. So no worries, no worries. Of course, Bella, of course. Are there any other questions? I know that there are a couple of questions regarding international students. And so that question is asked on the applications, but the only reason why it is asked is because we have to go through a little bit more of a process to get payment. And so we're not discounting our international folks. So please, you're more than welcome to apply. Okay. Are there any other questions that are burning that you would like us to answer? I will say there's just some like little FAQs that are coming to my mind a lot. The number one is, are these virtual opportunities? That's always the first question that we get asked. And mostly, yes, it is a virtual. Most of them are virtual. Some of them will require some type of in-person event, meeting, some type of a component where you will have to go into the Georgia Department of Public Health downtown or go to an event or go somewhere, what have you. But again, it depends on what exact position you are applying to. I will say for the CHOA, the child advocacy intern positions that are up for grabs right now, those 3 positions, those are in person at the actual Druid Hills location. So that is not a virtual position for you guys. So I hope that is helpful in all of those things, because we love our space, being in our cozy homes. And those are mostly the questions that we get, but it is on a case-by-case basis and position, but for the most part, they are virtual. So I'm going to go ahead and wrap it up and see if there are any more questions. You can unmute, and in the chat for a second, just hold the phone for you guys. Okay. I don't hear anybody unmuting, and I don't see anything in the chat. And so how we're going to wrap this up is you'll get an email if you registered, just like you're on the line now, and I'm going to upload this to YouTube. We're going to put it on our website, and in the email, you'll get all of the links to all the applications. You can go to the IPRCE website already and go apply, because we have some hard deadlines that are coming up very fast. If you have any questions, you can email IPRCE@emory.edu, and we'll get back to you as soon as we can. And if there's any questions about the applications, again, just email IPRCE at Emory. We'll get back to you as soon as we can. We wish you good luck. We are hoping that you are finding this webinar helpful. And thank you so much for attending, and we hope you have a great weekend. Thank you so much, everybody.